This week we're going to talk about two things. We're going to talk about the joints of the skeleton, and we're going to talk about the muscular system. The joints of the skeleton are made up of immovable joints. These are joints or bony junctions that do not move. As I talked last week, the skull is an example of bony junctions that do not move. Slightly movable joints, that is, joints that have a small range of motion. A good example of this is the vertebral column. And then freely movable joints, which have a much wider range of motion. One rule is that the greater the mobility of a joint, the lower the strength of that joint. And so, for example, the immovable joints tend to be extremely strong and do not allow the bony junctions to separate, which is good when you're protecting the brain, like in the skull. Conversely, a highly movable joint, like the shoulder joint, supports some degree of strength, but it's also easily dislocated under a significant force. What is the structure of freely movable joints? First of all, freely movable joints tend to have a fluid that we talked about last week called synovial fluid. This is a clear fluid that's water-based, and it acts as a lubricant for the joint. The joints are generally held together by something known as ligaments. Ligaments are strong, fibrous connective tissue that holds the bones together in the joint. The joint capsule serves as a container for the synovial fluid, and then there's a synovial membrane inside the joint capsule that produces the synovial fluid. What are some types of freely movable joints? First is the hinge joint. The hinge joint allows bones to move back and forth in a single plane. It tends to be very mobile and less strong. A great example of a hinge joint is the knee. The second type of joint is the ball and socket joint. This allows for movement in multiple planes, not just in a single plane, and is most mobile. And a good example of a ball and socket joint is the hip joint. The third type is known as the pivot joint. And I actually discussed this a little bit last week when I was talking about how the radius and the ulna function together. And this allows rotation in movement. And two examples of this are the atlas and the axis. If you remember, the atlas is the C1 vertebrae that holds the skull up, and the axis is the C2 vertebrae that allows the skull to turn from right to left. And then the ulna radius joint. The next is the ellipsoid joint. The ellipsoid joint is found in the fingers and toes. This allows movement in two planes, up and down and right and left. Now generally the up and down is more mobile than the right to left. Next is the gliding joint. The gliding joint is where one bone glides across the surface of another bone. An example of this is the wrist. This is also seen in the ankle. The next one is the saddle joint. There's only one saddle joint in the body, and that's the saddle joint in the thumb on each hand. This is when the two bones are shaped like saddles, and they come together and they move consistent with that. And you'll notice that your thumb has a significant and extreme range of motion. Now, with that discussion of the kinds of joints, let's look for a minute at the various problems that can occur with joints. The first of these is arthritis. Now, arthritis is the inflammation of the joint. Now, something I want to talk about briefly here is the idea when you see the word itis, I-T-I-S, this ending on any word, it means inflammation. And it generally means, when it's used, that there are the four classical signs of inflammation. So, for example, if you have bursitis, that's inflammation of the bursa. If you have arthritis, that's inflammation of the joint. If you have retinitis, that's inflammation of the retina, etc. And these four classical signs of inflammation include the following. Pain, which the Latin word for pain is dolor, redness or rubor, swelling or tumor, and heat, which is cholar. Now, inflammation does not necessarily have to have all four of these, although it's fairly common to see this, all four of these signs present. Some are less obvious than others. But when you really shouldn't use the word arthritis unless you see the signs of inflammation. Many times people will talk about arthritis when there's only pain present or only swelling present without the other evidences of inflammation. And this can be confusing because inflammation and recognizing inflammation is very important in making a diagnosis and understanding what's going on. One type of arthritis that affects the joints is called osteoarthritis. This has been called wear and tear arthritis, or wear and tear on the joint over a period of time. And this diagram at the top shows most of the classical findings with osteoarthritis. The first of these are these little nodules that always appear on the most distal interphalangeal joint, called Heberdine's nodes. The swelling that's associated with this is fairly uniform across the three joints in the wrist or in the hand, and it's called fusiform because it's like a hot dog in terms of the way the swelling occurs. There's minimal damage to the joint and minimal disfiguration of the joint in osteoarthritis. And it tends to affect the distal joints, like the fingers, more than the proximal. This is called the metacarpal interphalangeal joint here, or the wrist here. And so osteoarthritis tends to be more distal, and this is also true in the feet, than proximal in the hands. Osteoarthritis can affect the knees, it can affect the shoulders, but it does not tend to affect those joints as much as the more distal joints in the fingers and toes. Now, the other type is called rheumatoid arthritis. Now, obviously, there are multiple other types of arthritis, but the two I want to focus on for this class are rheumatoid arthritis and osteoarthritis. And rheumatoid arthritis is characterized by an immune attack on the joint. For some reason, your immune system decides it doesn't like your joints and begins to cause serious inflammation in the joint. Now, there are significant differences between osteoarthritis and this bottom, which is rheumatoid arthritis, and it's pretty obvious that you can see this. The first is because it affects the metacarpal phalangeal joint here, it causes a deviation of the fingers, and it's called ulnar deviation because it deviates toward the ulna. And so patients with rheumatoid arthritis almost always have ulnar deviation. The second is there's greater involvement in these joints, the MCP joint, compared to the distal joints, although it does affect the distal joints as well. There's a couple deformities that are classic for rheumatoid arthritis. One is both of these are caused by destruction of the joint and then subsequent destruction of some of the tendons that are around the joint. One is called the swan neck deformity, which is shown here, and another is called the boutonniere deformity, which is usually found in the thumb. The last thing I'll say about rheumatoid arthritis is that rheumatoid arthritis is a systemic disease. It's important to understand that's true, which means that people with rheumatoid arthritis can have other effects of their disease other than just joint problems. It can affect the heart, it can affect the lungs, it can cause serious problems outside of the joints. Another problem that occurs in joints is called a strain. What happens with a strain is when you bend a joint in one direction or another beyond where it's supposed to go, for lack of a better way of saying it. This tends to stress the ligaments holding the joint together. So, for example, if you bend your ankle or your foot in toward the middle in such a way that it puts stress on the ligaments on the outside part of your ankle, then you sprained your ankle. And obviously, the more stressed it is, the worse it is. And it can get to the point where those ligaments actually tear. in which case they frequently have to be surgically repaired. Another problem that happens with joints is called a dislocation. And a dislocation occurs when the bone comes out of alignment with where it's supposed to be. In other words, if the finger, for example, becomes dislocated from actually it would be in this area right here. If this the metacarpal phalangeal joint is dislocated, what would happen is this phalanges would be pulled out from where it's supposed to be and would be directed in a direction it's not supposed to go. And basically what you do is you pull this out and put it back into place and put it back into alignment. Obviously, the larger the joint is that's dislocated, the more problematic it can be. The last, as I mentioned before, is you can tear the ligaments in the joint. Classical sports injuries, such as you'll hear on TV that the person had an ACL tear. That's or a PCL tear or a medial MCL tear. What they're talking about there is the anterior, posterior, and medial collateral ligaments. These are all ligaments in the knee. So if your anterior collateral ligament, which prevents your knee from moving forward, prevents the tibia from moving forward, if it's torn, then that action, that is that movement of the tibia forward, can't be stopped. And there's an abnormality. But the bigger problem is the pain and inability to walk that's associated with that.